Awesome. Well, welcome to another Tech Docs Lunch Chat. I'm Alex George. I'm the head of marketing here at Hint, and today I have the pleasure to have Dr. Reza Ghomi. He's joining us from BrainCheck, and today we're going to dive into cognitive health. This is something that we're doing just as a recognition to Alzheimer's and Brain Health Awareness Month. And we're really excited to have you. Just as a reminder to everyone joining, we want you to engage. Feel free to post in comments and ask questions, get involved. This is really a conversation. But really, Dr. Gomi, let's go ahead and kick it off and allow you to introduce yourself and tell me a little bit more about what BrainCheck, the platform, does.
Thank you. Yeah, thanks, Alex. Thanks for having me today. I'm glad to always speak with primary care docs. My background, just by way of introduction, I'm a neuropsychiatrist, which is a very small subspecialty, but I did training in both psychiatry and neurology, and even some movement disorders and behavioral neurology. The goal was always that I wanted to focus on neurodegeneration. So dementia is one big umbrella. Obviously, there's a few other ones kind of adjacent. And so that's my background. That's how I practice. I really focus on the dementias. Part of that practice was then realizing very early on this huge bottleneck when it came to neuropsychological testing, cognitive testing. I was waiting routinely, 6, 12, 18, even 24 months for results. And so, as a resourceful doc, like many of us, I had to figure out, well, how can I get results faster? I got to figure something out. I stumbled upon BrainCheck in its relatively early days, and we started working together, and kind of the rest is history. And so the goal was always, how do we help someone figure out what's going on inside their head, like thinking wise, where are their deficits, where are their strengths, and then how does that lead down the pathway to any kind of potential diagnosis or reversible causes. So that's how BrainCheck really started, and that's what BrainCheck aims to do.
Awesome, cool. And so, kind of just to dive into it for a second, so it's a platform, something that you use on like an iPad, desktop, iPhone, I imagine. Is that right?
Correct. Yep. It's device agnostic. You can put it right. If you're in person, you can stick it in front of the patient on an iPad or on the computer. Or if you're not with the patient, if it's telehealth, there's a remote functionality so that patients can use their own device at home. And it takes about the standard battery. There's some customizable aspects to it, but it takes about 10 minutes. And then they'll be able to go through, do the test. The primary care doc or whoever's ordering will get the results and be able to review that with the patient.
Very cool. That's awesome. Well, what we wanted to kind of start this conversation off with today is learn a little bit more about, hey, what are some trends in cognitive health that you're seeing, or cognitive care in general? We have a pretty big viewership, mostly direct primary care physicians, primary care practices, and so like the goal here is educating them a little about, hey, what's new and happening in cognitive care.
Absolutely. It's a space that I think many of us have seen has been heating up the last few years. There's been a lot of headlines about new treatments, specifically, pharmacological therapies, medications. One thing that's become clear, though, with all the back and forth with approvals and Medicare and all this, and the FDA, is that the treatments that are really out there, they tend to work a lot better the earlier your patient is in the course of their disease. So if you're diagnosing earlier, they're going to be eligible for more treatments. And these upcoming drugs that are being released are really focused on early stages. So that's really adding some, emphasis to, well, we need to get early diagnostics out the door. And so there's a lot of research around that. I do think in addition to new treatments that are all kind of trickling out right now, that's heating up, there are going to be more diagnostic tools like peripheral blood tests, more imaging options. That's all happening. And then this emphasis on cognitive testing, which is kind of a core part of the diagnostic process, being able to quickly and accurately, characterize what a patient's thinking is. And so we've kind of seen that's the current trends. And we still live in a world, at least in the US, where more than half of people with dementia don't have a diagnosis. And we've proven that if you don't have a diagnosis, we just know that your outcomes are worse, meaning you're more likely to end up in an assisted living or a nursing home type of facility. You're more likely to leave your home, have falls, end up hospitalized, those kinds of things, which is obviously devastating to those patients and families. So the earlier we can screen and diagnose, the impact is very significant on those outcomes, even without a cure. That's what I wanted to really emphasize. This comes up a lot with primary care docs. I need to really be clear that despite not having a cure, you're able to add years of quality life to a patient, for a patient and family. And so that is, as we all know, is extremely valuable. No one turns that down. So there's a lot of motivation behind this work.
That's amazing. Yeah. And you mentioned something there, maybe not everything's reversible or curable, but there's also the opportunity to slow things down. Um, can you give us an example of maybe something more recently or something that you've seen in your practice in particular that is, a way that BrainCheck has ultimately led to a success story?
Absolutely. In addition to the cases where it's helping along the way of a diagnosis to dementia, then leading to giving you the care plan and giving that to the family, what's great to see is all these ancillary, if you will, benefits. So, for example, I worked with several DPC docs, actually in my area, like in Montana, Wyoming, Idaho. My practice's focus is rural areas, and there have been really countless cases where I might get sent a referral and I'm reviewing the patient, and it turns out, they have sleep apnea. The DPC did the workup. They have a CPAP ordered, but you know what? They just haven't really gotten around to using it, or they just don't like the fit of the mask. But with BrainCheck, I show them their cognitive status, and it lights this fire. And they realize, oh my goodness, with sleep apnea, I'm like accelerating my risk for, dementia, vascular dementia, Alzheimer's, and I'm actually thinking poorly now, and it's affecting my work performance. They go on, figure out the issues. They use their CPAP, and 3 months later, 4 months later, we retest on BrainCheck, and their performance has normalized. That's incredibly rewarding for that patient and reinforcing, right? They're like, wow, okay, this was really worth it. And what's great is it gives a primary care doc objective evidence that, hey, this was a reversible cause. And that's one example that's come up even recently, but that very consistently comes up.
That's really cool. Now, are you seeing with that sort of stuff? I mean, you're enabling the patient to make a better decision for themselves, right? So like technology is really enabling that, and the primary care doctors, or in our case, our DPC docs, are able to kind of position themselves as the leader in that space and helping drive their entire health model home. So I love that. I think it's very much aligned with what we see in DPC. Naturally kind of leads more to face-to-face between doctors and patients, and early catching and diagnosis of cognitive conditions. So that's great. Kind of looking more into the tool itself. If a doc wanted to use it, what does that look like? How do they access it? Where, what's the process for utilizing something like BrainCheck?
BrainCheck, we've tried to make it. We've always been focused on the clinical user. So we didn't start in the research space. We really started in the clinical space. So we try to make it as easy as possible. It's as easy, you can get on the website and sign up, in seconds. And really, at that point, it's just a matter of, whether you or your staff member you can have workflow variations, of course, but depending on if you're doing it or you have a medical assistant helping, or if the patient's at home or in the clinic. But really, at that point, you log in and you can just enter, a couple pieces of patient information like name and date of birth. That's enough. It's their contact information. They get either a message at home or in the clinic. You kind of set it up and hand it to them. But that kicks off the battery, and then they're off to the races. They sit down, they do that battery, and then instantly you get the report right afterwards. So, I mean, really, from even just signing up, if you never used it, to getting your first test, and if the patient's sitting right next to you and getting it done, that's 20 minutes to just get it done the first time. And then you can review the results with the patient, incorporate that into your note.
And so when does someone like you get involved? I mean, is there opportunities for referrals out to have conversations more in depth about more specific issues, or what does that look like?
That's a great question. Part of our challenge and our goal is to provide as much comfort and information to those end users, especially primary care docs. They're really driving the majority of dementia care in the U.S. But in those cases where maybe, the clinical course is not quite clear, maybe there's some rare, confounding factors, I tend to see, I mean, see all kinds of things, but I tend to see rarer types of dementias, maybe that 5% or less that are unusual. Like many people realize, like Bruce Willis recently, where I was diagnosed with frontotemporal dementia, primary progressive aphasia subtype. Those are the kinds of things I tend to diagnose, or frontal variant Alzheimer's disease. There's all kinds of rare subtypes, but there are times when it's just, I get it, primary care is overwhelmed, and they're, hey, can you just please handle this, dementia diagnosis workup and the care plan? That's kind of where BrainCheck comes in. Is, well, you know what? Now you really can do it. It's meant to be accessible. You can do, look at some reversible causes, do some cognitive testing, make that severity diagnosis. Is it dementia? Is it mild cognitive impairment? And then give them the care plan. And the care plan being automated honestly takes so much of that burden off, because what we realized is, even once you make the diagnosis, the big question is, well, what's next? What do I tell this person? Where do I send them? I don't have a social worker. I need all these resources. That's where the care plan comes in. It customizes and walks you through the patient and family. And so it makes it really easy for the primary care doc to sit down and just go through it and say, hey, here are the resources. Here's what to focus on. And this will help you, get to that next, get through this next phase.
Awesome. That's really cool. What types of things are you seeing in your specific practice? So I know that you kind of serve the virtually, you serve kind of the Wyoming, Seattle, Oregon, kind of all of Pacific Northwest into Central. Like, is there any regional trends that you're finding that are really interesting to share?
I think in the way of practicing, because I'm in a more rural area, it is heavily relied upon, tends to be fewer resources, in a close distance. So I end up having, even when I'm seeing them as a specialist, a lot of times my patients are driving many hours to get their brain MRI or any other specialty testing. So that's always a consideration. There's a lot of, resource wrangling that has to do with that, especially for people that can't drive. And then, so BrainCheck's remote testing feature really was huge for us, especially when COVID hit, because we didn't have to slow down. We were still doing cognitive testing when in-person cognitive testing had completely shut down. So I think in those rural areas, there's much more reliance on remote technologies, like remote patient monitoring even, and other ways to track patients, compared to, urban areas where I've also did my training. So I think, regardless of where you are, if you're a DPC working in an urban area or rural area, there's workflows that I think can work for your clinic.
Awesome. Cool. Yeah. Just a reminder again, anyone that's joining us here on the live stream, if you have any questions or would like to dive in a little bit deeper, feel free to chat in those questions. We're happy to take them kind of on the air here. Apart from that, so let's just talk a little bit about your kind of familiarity with direct primary care and doctors that maybe you've kind of been working with. Maybe you don't have any names or name drop, but like, how often are you seeing that direct primary care doctors are taking something like this into their practice? Are they adding it on as an additional service, like at cost, or is it built into like, hey, an annual cognitive test as part of their membership? What are you seeing in that front?
That's a good question. I've actually seen a bit of both. So I definitely seen some practices who kind of have it almost like as a la carte add-on, and patients understand that, and the cost is relatively minimal, so it's usually not, I think, causing a big problem. But I've also seen DPCs, just build it into their membership fee so that it's ongoing and just less for the patient to think about. So I've seen it both ways, but I think in either way, what I've heard and what I've seen myself is generally positive response. Patients love having an objective measurement of their thinking in front of them. The report is something you can print out or email them, so they have a copy of it. In general, I think it's highly appreciated. So it seems to me there's this sort of, reinforcing almost ROI based on, the patient satisfaction as well. And in many cases, I think that can be, what's counterintuitive is sometimes we think as a provider, hey, I don't know if I want to give this patient, it's hard giving bad news and like, ooh, they didn't do very well in this test. I don't know how to say that. I'm always amazed at, I mean, especially when I was in person, patients would like stand up and hug me and say, oh I just wanted someone to, give it to me straight and tell me what's going on. I knew something was bugging me, or families the same way. I knew, grandpa or dad or my brother or sister, it's like something was wrong. And just seeing it on paper and seeing that, I find to be the vast majority of the time a big relief. And so I like to also emphasize that it's, I'm always tickled when like primary care sends me somebody, or they have a question, and I'm just kind of looking at their brain check to help them out a little bit. They say, wow, the patient was really happy with this. Like, but they're doing, it was a terrible score. They're, for some reason, they're like, I'm like, yeah, people want to know what's going on. And that sometimes supersedes, the fact that it's quote unquote bad news. Because really what it does is, right, all of a sudden now you have information, you can act on it. It gives people back their locus of control. And that is in large part, right, very reassuring. So that's been a really, just kind of a almost like unexpected but positive, result I've seen.
Awesome. Cool. Great. Well, we haven't had too much engagement today, unfortunately, but I would just put it to you, is there any other last kind of thoughts that you want to share with the group of listeners, people who may be engaging later on? Oh, we got a question that just came in. How do you identify patients to take a brain check?
So great question. So, we've seen a couple approaches out there. You can certainly do it on an individual basis. Let's say you're, DPC, you're in clinic, patients coming in. It could be a complaint from a family member or a loved one. It could be a complaint from the patient, or it could be you're concerned. That's kind of what we consider medical necessity at this, like CMS, official, definition. So that can trigger, hey, I'm going to order a brain check for you. So any level of concern from anyone is enough to justify that. That's the kind of formal response. But what's nice about BrainCheck and the fact that it's easy to roll out, we've been using it more of like a population screening level. So like everyone over the age of 60, for example, you could decide, you can pick an age, but I just have anyone over the age of 60 comes through the door is going to do it. And anyone with other types of factors. So like if maybe like, someone has a sleep apnea or any other comorbidity like depression or anxiety or hypothyroid, annually they're going to get a brain check. So I would say pick the method that's comfortable for you, whether it's maybe some general guidelines and your staff just know, hey, everyone just do it. Don't even ask me. Or, some providers like, for now, until I get comfortable, I'm just going to order one at a time based on it. Both are completely fine options.
Great. All right. Well, yeah, I was going to say before that came in, is there any like kind of last thoughts you want to leave the group with?
So it's a good, and I just saw that this other question come in too. I can jump on that if you want.
Yeah, that'd be great.
So why would a practice use a brain check over paper and pen tests? So it's a great question. I would say a couple things to highlight and sort of some of the benefits to brain check. Paper and pen tests, like full cognitive tests, which really happen, with a neuropsychologist. I still, by the way, I still use my neuropsychology colleagues. They're extremely helpful in the rarer cases early on that are hard to differentiate. I still use neuropsychology, and they're very happy to have those cases. But the millions of people that have, kind of sort of average, Alzheimer's disease, vascular dementia, they don't need that level of testing. They just need some basic testing. Now, if you send them to paper and pencil testing, that's many, many months wait. It's thousands of dollars. It's extremely expensive for the patient. It's slow, right? The reports you get back, typically, I think from my experience, primary care docs have a really hard time interpreting the reports because there's like 30, 40 pages, extremely dense text, and it's hard to translate for the patient. So those are just some of the drawbacks. But again, there's a place and time for them, and it's extremely valuable as a service. But this really, BrainCheck just streamlines it. It's quick, it's easy. The patient, it's intuitive. There's very little in the way of instructions or setup. So those are some of the benefits. And then I'm seeing a question about, so what does BrainCheck tell us about a patient who has ADHD or ADD, anxiety, or depression? So the behavioral health space, which I also, really spend my time in, one thing I've liked about BrainCheck, and especially in this era now with all this hubbub about, as you all have heard about, like, controlled substance prescribing and the in-person requirement, all of this, BrainCheck gives you an objective measure to help you see, okay, someone's asking about, hey, do I have adult ADHD or ADD, or a younger person? and you want to know, well, BrainCheck will then objectively tell you, well, what's their attention doing here, and what's going on with that. So that kind of gives you a nice little reassurance that, hey, you know what, if we're going to try a medication like a stimulant, I feel justified. I have this objective measure. So I think that's really helpful. It also helps people with anxiety or depression, any behavioral health diagnosis or issue they're dealing with, see like the impact on their thinking. Like, man, I didn't realize I was depressed enough or anxious enough that like I'm having trouble performing on this test. And so I think that's also objective data that's really helpful, especially in primary care, where primary care are the front lines of mental health in the US, right? 80% of antidepressants are prescribed by primary cares. So they're not getting to specialists, but it's really hard. Sometimes patients, it's kind of a vague complaint. But again, they see the objective measure that can help them, take some actions. Great. Great question about, so we get this asked a lot about cognitive tests like BrainCheck over MoCA or SLUMS. The thing to just highlight is MoCA and SLUMS, MMSE, all of those are purely screening tests. They really have a hard time picking up early stages of dementia because they have a very clear ceiling effect, meaning when any of us on listening to this webinar today took any of those tests, we would just get perfect scores, 30 out of 30 over and over again, right? Until we don't. But by the time we don't, there's significant protein aggregation, right, and disease going on in our brain. So did they play a role? Great. But I think with technologies happening, with the treatments that are coming out, the diagnostic tests, I think we'll see those largely phased out pretty soon here in the near future, just because, they don't help us catch things as early. And at the end of the day, they're screening tests, so they don't really help us diagnose all that well. So those are that's why I've done hundreds and hundreds and hundreds of MoCAs and SLUMs and MMSEs. And, I stopped doing them a few years ago just because I had access to a more sensitive and specific test. The domains question, great question. What domains does BrainCheck assess? It touches on the core domains, like executive function, attention, memory, and so on. We actually have an ongoing couple studies right now, larger studies like adding some more language domains, some visual spatial domains. So it gives you sort of like a couple tests in each domain so that it tries to fill in this picture of, well, because you can see sometimes, plenty of times some domains are intact or strong while others are lacking. So you'll see that differentiation. That's another benefit over screening tests. That's a great question.
Cool. Great questions. Love to see the engagement and see what people are kind of interested in learning more about. Is there anything else on that side that you want to kind of double click into or kind of talk a little bit more about? Or you feel like we've kind of wrapped up? How can people get in contact with you if they have questions? And obviously, if BrainCheck is something you want to check out, you said just go to the website.
Absolutely. I mean, come to the website. We're extremely responsive. So if you just reach out through the website, someone will get back to you very quickly. We have a lot of online guides, both in writing, videos. I try to, do as much educational material as possible, just to help get started. It's a big step, right? It's capturing someone's cognitive status, walking them through the diagnostic process for dementia. That's a big deal, and given, we're doing part of this reason we're doing this, right? It's Alzheimer's Awareness Month. And so, my soapbox is all about how to help primary care docs feel more comfortable taking these steps and doing this work. It's critical. It really is extremely rewarding. Patients and families are so appreciative when we do take this on. But the reality is, I know it's a difficult work, and it takes time. And so, hoping that tools like BrainCheck help alleviate some of that that time burden.
Awesome. Well, again, Dr. Ghomi, thank you so much for joining us today. Really appreciate it. If anyone joined late or missed it, this will be available streaming on all of our different social media platforms and YouTube as well. And we'll share it out to our customers and people who are interested in following us on social media. Oh, we have one more question come in here at the last minute. We have, let's see what we got there.
Yeah, when sharing more about the care plan provided. If we have time, I'm happy to.
Yeah, go ahead. That'd be great.
So in terms of, I think Deborah's going to get the gold star today for those questions. So the care plan, when we developed the cognitive testing, we realized we just kind of had sort of unintentionally moved the bottleneck. It was easy to get cognitive test results, but then the what's next. So now that feeds into the platform. We'll actually grab some information from caregivers, loved ones, the provider, and then automatically and immediately assemble a care plan. Might be 10 pages, it might be 14 pages. And so what's kind of nice is it goes through domain by domain, lifestyle modifications, diet, exercise, sleep, and so on. Again, with customized aspects for the patient, like depending what treatments they're on, what medications are already on or could be on. And again, it's a living document that you can revisit twice a year, for example. That's what on average is recommended, and that way the patient and then any other providers involved, family members involved, it's like an easy central document that they can share, and everyone can be on the same plan. Like, oh, hey mom, you're supposed to be walking 30 minutes every day. Great, let me help you do that. Or, oh, you have you're supposed to follow up with the eye doctor because you've got cataracts coming. So it's a really quick and easy way to hand like this nice, just, hey, this is what you need. This is what to focus on.
Awesome.
Hope that helps you.
Yeah. Cool. All right. Any more last minute burning questions? If not, then we will go ahead and wrap it up. Again, Dr. Ghomi, thanks so much for joining us today. We appreciate the partnership and look forward to DBC doctors beginning to use BrainCheck in their day-to-day. Talk soon.
Thank you. Thanks, everybody.
All right. See ya.